Welcome to Management Matters. I'm James-Christian Blockwood. This week on the show, we welcome two government leaders with decades of executive experience and time spent at the helm of two of the most high-profile agencies in government. Secretary Bob McDonald, formerly of the VA, and Commissioner Martin O'Malley of the Social Security Administration join us now. We'll explore their innovative approaches to public service, leadership philosophies, and the transformative changes they implemented in their respective roles. Thank you both for joining us.
Thank you.
Great to be here.
Making government more efficient has been in laser focus this year. You both led processes to make sure your respective prior organizations were more innovative and more modern. Can you give us a sense what you were trying to accomplish, why, and what was your biggest factor for success? And let's start with you, Secretary McDonald.
Well, thank you, James-Christian. It's great to be with you. I think the primary thing for me at the time was, how do I improve access to care for veterans? There were 45 veterans in the spring of 2013 that had adverse medical consequences because they weren't getting care. We discovered later that was a problem that was endemic across the country. So what we had to do was improve care for veterans. We did that by, first of all, creating a purpose, which was to improve the care of veterans. Second of all, implementing training, asking for commitment to our values, the values that create the acronym ICARE: integrity, commitment, advocacy, respect, and excellence. And then third, and I put them in this order purposely, third was create more clinics, have more clinic hours, hire more doctors, hire more nurses, and increase the pay of the doctors. That's basically a short summary of a difficult 3+ years.
And Commissioner O'Malley?
It's an honor to be with you and also with Secretary McDonald. And he was one of the first people I called out to once I got through the laborious and torturous process that we call Senate confirmation. And I read the Harvard case study on his leadership of the VA. And so, Mr. Secretary, thank you for your inspiration. We stole every good idea we possibly could from you. My challenge when I was asked to go there was this. When the White House called me and asked me to go to Social Security, it was not because things were going well. Congress had for 10 years been reducing the staffing at this agency so that it was now at a 50-year low when the White House called, and their customer base was rising because of us baby boomers. I'll just speak for myself, because the customer base was at an all-time high, a new all-time high every day, and yet their staffing was at a 50-year low. So every service delivery metric for getting the right amount to the right person at the right time for a benefit, oh, by the way, that everybody had earned, we're going in the wrong direction. And we needed to turn that around. So in order to sprint up that downward moving escalator with the workloads, it required doing many of the things that Secretary McDonald first did at the VA. I barnstormed every one of the 9 regions, and I listened. I was present. I met people with where they were at. And for 3 years in a row, they had listed themselves the most demoralized and overworked place to work in the federal government. So we had to acknowledge the negative. I had to acknowledge the negative with my tiny little new team. We only have like 20 political appointees at Social Security, and I was only allowed to fill one of them. So we had to acknowledge the negative and then appeal to the shared core value in order to get the agency moving in the right direction again. And they did. In fact, some of the metrics that we achieved were, the best they'd been in 10 years, the effectuation of retiree benefits. It required a lot of not only change management, but communicating the change to the workforce so that everybody felt like they were part of what we were doing for ourselves rather than some guy from the outside doing something to them. It was about their values. And that's certainly something that Secretary McDonald tapped into at the VA in his time as well.
Commissioner O'Malley, you mentioned that you were called at a certain time and the White House had specific reasons that they wanted to bring you in to help either reform or modernize. But how hard is it to modernize government, and what are the consequences of keeping it the same way? Do you think the SSA is currently on the right path?
Change is difficult, but everybody at Social Security understood that we needed to do some things differently, or we were just going to continue to fall further and further behind. The logs were going to continue to grow. Let me give you one scary one. The disability aspect of Social Security, which was signed into law by Dwight Eisenhower in, I think, 1953. More people now die waiting for their initial disability determination than ever before in the history of the program. And that backlog had been going up for like 12 years. COVID didn't help reduce that backlog. Key to how we turn those things around, and by the way, we managed to make that backlog go down by June. Didn't immediately make it start going down. But by mapping the process, by identifying where there was waste in that process in terms of the number of days it takes to do any one of the steps along the way, we were able to get that backlog moving, going down instead of up for the first time, I think, in 12 years. And some of the states got a little bit better. The key was that we were at it all the time. I mean, Bob, I'm not sure what your method of management is. I learned STAT, which is, we call it, at New York, Bill Bratton called it CompStat. And his guru was Jack Maple, a deputy commissioner for operations. And Jack, taught me how to do this. We called it city stat, 311 on the front end, then state stat. And so we did security stat. So we tricked out a room within 30 days. So while I was barnstorming and doing the town halls, the hammers were swinging and the carpentry guys were tricking out a room that was 90% of what we needed, but we made it a very collaborative space. Conversation in the round every 2 weeks on our 8 big challenges. So one of those was the disability. Another one was the time it takes to answer the phone. And it was on average on the 1-800 number for 7 to 8 million people a month. Speed to answer was 42 and a half minutes. We got it down to 12 and a half minutes. But we didn't do it in one fell swoop. It was every 2 weeks, every 2 weeks, every 2 weeks, gathered around and running the plays, if you will, like a football team, right? You call a huddle, you run a play, you measure yardage. If that worked, we do more of it. And then you go on to the next 3 most impactful things that can help you move that metric. So almost every one of those was moving in the right direction by the end of the Biden administration. Keep in mind, Congress had cut the president's proposed budget by $3 billion over the 3 years before I got there for Social Security. So all-time low in staffing, and yet they got everything moving in the right direction with the exception of the processing centers. That backlog continued to grow. Right now, because of the meat cleaver and the chainsaw they took to the agency, they've paid people with our money to quit now. No knowledge transfer, just get out. Don't let the door hit your backside on the way out. So they have exited about 7,000 people. They're probably gone down now from 55,000 to around 49,000. I think they'll have lost, 10,000 by the time July gets here. So understandably, it's like a school system, right? If you suddenly have more students than ever in school and fewer teachers, then the class sizes are going to be bigger, and it takes you longer to get to the kids that are struggling. So every metric, once they created the hostile work environment, the illegal mass firings, paying people with our money to leave, all of the metrics have gone in the wrong direction, and they're going in the wrong direction fast. And I think the agency itself is headed in terms of its IT systems, to a total system collapse. I'm kind of surprised that hasn't happened already.
James-Christian, one of the things to draw a connection between what Governor O'Malley said and I said, I think you heard a couple of things that are very important. Number one, federal workers want to do the right thing. They're committed to the task. They want to improve the lives of veterans. They want to get the Social Security checks out. I was the beneficiary of the governor's work. I turned the appropriate age while he was commissioner, and I saw that firsthand. So they want to do the right thing. And of course, when they're successful, success is contagious and it carries on. Secondly, leadership matters. And I often say leadership is the most scarce resource in the world. When you get the right leader, like Governor O'Malley as commissioner, leadership makes a difference. So I like to say organizations are perfectly designed to get the results they get. If you don't like the results, get a new leader.
Yeah, I absolutely agree with you, Secretary McDonald, that leadership is the single greatest factor to enabling change or for success for any endeavor. Let's talk a little bit about that. You heard Commissioner O'Malley talk about his method of management and talk about how change is difficult. Secretary McDonald, I've worked under your leadership and the Department of Veteran Affairs as being one of the second largest departments. You've had your challenges when you were there as the leader. What is your leadership philosophy and how did you use it to overcome some of the challenges that you encountered?
Well, through my 33 years at the Procter & Gamble Company, living and working all over the world, I developed a leadership model. And as I kind of referred to in my opening comments, it starts at the bottom with the purpose, values, and principles. Your organization has to have a purpose, has to have values, and everybody has to adhere to those. And while our problems look like scheduling problems in 2013 when I took over, they were really problems in people not having a purpose, not having ascribed to the values. So we had to start there. Secondly, technical competence. And obviously at the VA, the largest medical system in the country, we have tremendous doctors and nurses. We train 70% of the doctors in the country. We have the biggest force of nurses. And then we need passionate leadership, sound strategies, robust systems, and a high performance culture. And culture was really probably the biggest issue we faced. Whereas as I went around the country, just like Commissioner O'Malley did as he took over, what I discovered was we had an employee base that said they were victims of a system they couldn't control. And what I had to do was say, no, you're not victims of a system you can't control. We're actually going to train you to be leaders of that system. We're going to expect you to take initiative and to innovate and to change that system, because our primary purpose is caring for the veteran. It's not about our organization, it's about the veteran. And so we invested quite a bit in the training and development of the employees. And we also changed our strategies. So strategy number one was to care for the veteran, but strategy number two, quickly behind that, was to care for the employee. Because if you're in the business of serving others, you can't serve others unless you care for the people who do that, and that's the employees.
Secretary McDonald, you did draw upon your experiences from private sector. Being a CEO and being the head of an agency are similar, but at the same time, you could argue they're vastly different in how you'd have to go about it. What is it like leading in these different sectors, and what can government learn from the private sector, and vice versa? What can the private sector learn from government?
As Commissioner O'Malley and I both allude to, leadership is the common denominator. Leadership matters. Leadership makes a difference. If your organization doesn't have a single leadership model that creates a vocabulary in the organization, that you recruit for that leadership model, you develop for that leadership model, you train for that leadership model, then I would argue it's never going to become a high-performance organization. So we develop a leadership model, and we train the people to live that leadership model. And then what we have to do is we have to get the right leaders, to use Jim Collins' phrase, we have to get the right leaders on the bus and get them in the right seats on the bus. And over my 3 years, I had to change roughly 14 of the top 17 leaders. That didn't mean they were all fired. They were just in different jobs. Then we had to develop the right strategies. And we had 5 strategies: caring for the veteran, caring for the employee, and put in place the programs that would help. So that's all the same. The only difference is you have to execute a little bit differently, because in the private sector, you've got stock options, you've got financial rewards, you've got other things, and you've got a lot more flexibility than you do in the public sector. But in the public sector, you've got a greater reliance on the power of purpose and the power of values and the ability to paint across a tapestry, which is across the whole nation. So there are differences, but execution is where it shows up, not in the principles of leadership.
Commissioner O'Malley, you've led at the city level, the state level, and obviously at the federal level at SSA. What were the biggest challenges you faced in transforming public agencies, and how did you overcome any institutional resistance to change if you encountered that? And what practices might you then kind of share with current leaders in public administration at this moment?
Most important thing is in the culture of a big organization, call it a corporation, call it an agency, what you will, call it a country. If you believe you can or you believe you can't, you're probably right. And what good leaders do is they help people believe that they can. And that's not about flowery speeches. It's not about giving out free brownies in the cafeteria. It's about being present. It's about listening. It's about taking action. And it's about getting the measurable results that you can communicate through the whole organization. But small things done well make bigger things possible. So you can create this whole momentum, this cadence, if you will, where the organization starts to lean forward, and soon they shed that kind of victim thing, Bob, that you were talking about. And we had it at Social Security too. I mean, those cats on the Feds survey listed themselves 3 years in a row as the worst place to work in the federal government after having been one of the best just 12 years before. So we started going very fast. We started measuring results. And one of the things that they had a leg up on any government I had ever had to lead before was, man, they collect data. They are really good at collecting data. They collect so much data that they know what Secretary McDonald's first summer job was and what it paid and what mine did back whenever, they collect a lot of data. But here's the thing. Their aversion to ever sharing that data when it comes to personal identifying information also kind of crept in to this kind of defensive crouch. And they weren't very good at sharing the data across the different silos of the organization, if you will. That piece of collecting the data and actually making sure it was timely, accurate, they did. What we only began to do was to share it with each other. And that's what I have found is one of the most difficult things. In any big organization, people like to say, oh, we have meetings when we need to have meetings. But we created 8 meetings every 2 weeks. We live streamed it to all of the senior executives service in the country so they could hear the conversations going on the bridge of the enterprise as we struggled to turn that leaking battleship. We also live streamed it to our oversight committees, regardless of party, Republican, Democratic staff. I wanted them to see how we were wrestling with the problem of having a 50-year low in staffing, an all-time high in customers. And we also live streamed those meetings we allowed our overlords at OMB to hear how we were struggling and what we were doing. So the convening, though, is something only the leader can do. If you delegate to somebody else the calling of a huddle, you're not going to be able to run the plays. And so that's what I found, that the toughest thing is that government is almost conditioned to believe that its cadence of operations is annual budget inputs. And they'll give you 1% improvement annually, but that's not very satisfying. If you convene people every 2 weeks, I learned, people will give you 1% progress every 2 weeks. And when you look over your shoulder, that's a lot of progress.
Martin made a point that's really spectacular that we need to underscore for the listeners, which is the leader's job is to provide hope. And hope is based on substance, not on something ethereal. And the challenge when you're creating change is from the time the crisis occurs to the time you're able to see substantive change, you've got to provide hope during that period. But it's difficult because you don't have the big enough changes yet to confirm with people that they have hope. And that's why John Cotter, in his great book, Leading Change, talks about the importance of identifying small wins and making sure those small wins are publicized so people see you're on the right track.
Tell them about your 21 reasons. Remember that?
Yes, we had 21 reasons that we were the best medical system in the country. We put together something called the Road to Veterans Day, which was a 90-day plan to give people hope, small changes, before we get to the big changes. All of that's really, really important.
And we did the same. We borrowed a page from Secretary McDonald. After I went and did the town halls, we had somebody taking notes. And I pointed out the person that was taking notes. And a prior secretary had done that, or acting commissioner had done that before. But people were so jaundiced. The lady raised her hand at the one I did in Boston. She said, "Governor, please promise me you're not going to ask us to take another survey or submit more ideas that none of you will ever read or do anything about." So we took not only careful notes, but then we communicated back to people, hey, you told me about this when I was with you and sitting next to your colleague David in Boston. He told me about this ridiculous numbers of times you have to click over no to all in the application for SSI. I know this is just a little thing, but I listened, we came back, and the good folks here at headquarters, and everybody thought that headquarters didn't listen either. The good folks here in IT came up with an A version and a B version of a no to all button, since you've already interviewed the person. And it was just a 30-second little thing. We communicated it back to them, but within 90 days, we were able to roll out an action plan on the year that had 27 leading initiatives, 121 leading actions, and to Secretary McDonald's point, 51 quick wins. People saw that they were part of, like the Tom Sawyer whitewashing the fence. People saw that one of their ideas was probably in there, and it probably was, because you want to know how to turn an organization around. Talk to the people on the front lines that are doing the work.
We've talked about communications, we've talked about leadership. Commissioner O'Malley, you mentioned something small but had a really big impact, and it was around technology. Can you talk a little bit more about how data-driven decision-making and technology can be better leveraged to modernize government services and improve outcomes for citizens?
There are so many ways. I'll give you one that had gotten stuck that I discovered that pulled me into a dark room and said at kind of a skunk's works office because all of the regional headquarters had workarounds for the bad IT that had foisted upon them by the 10-year plan. There was an automated way that they had designed in Excel to speed up the processing of Medicare-only claims from 8 minutes to 8 seconds. But it kept getting stuck by somebody exercising the tyranny of no, whether in the law office or in the policy or cybersecurity or whatever it was. That was one example, but as Congress was reducing Social Security staffing to a 50-year low, it wasn't like they were increasing its IT modernization budget to a 50-year high. Congress level funded the agency for 10 years. That means the agency has to go find $600 million because their fixed costs go up, healthcare raises and the like. So the way they did that was by postponing IT modernization and by letting the grim reaper of attrition, or now the Doge team, wipe out staffing. And so there's a lot of things we could be doing to modernize the IT systems at Social Security. None of them is free. And there is, though, a whole roadmap to that. They know it needs to be done. They're not still on a COBOL-based system because they're stupid. In fact, the fact that they've never missed a payment in 90 years should show you how innovative they are, that on top of that COBOL system, they have like 2,000 different applications that continue to run. But there are huge opportunities for IT modernization in the federal government. I think IRS started going in that direction. Secretary, you probably had more success and more time there to get things rolling on that front than I did. We were struggling to keep our nose above water. And I was hopeful we would get an IT modernization budget, but I was not there long enough to see that happen.
Secretary McDonald, are there any technological advances that you would like to see at the Department of Veteran Affairs or government more broadly?
Well, as the commissioner said, many of our systems in government work on COBOL. COBOL is a business language that IBM developed in the 1960s and 70s. I learned to code it when I was a freshman at West Point in 1971. I could make more money at the VA being a COBOL programmer than I made as secretary because there aren't many COBOL programmers who are still living. Actually, we managed our roughly $300 billion budget using COBOL, and rather than reinventing a new way to manage our budget, we went out and used agriculture's budgeting software. Our scheduling system was dated to 1985. It was MS green screen, MS-DOS kind of thing, and we got rid of that. But the biggest problem I had wasn't creating the new systems. It was sunsetting the old systems. If you looked at, and I did this a lot at Procter & Gamble, if you looked at a spaghetti chart of all the systems and how they interacted within the VA, Congress would give us the money to create new systems, but they would never give us the money to sunset the old systems. So we were constantly trying to gerrymander the systems to connect with each other when the reality is we could have been much more efficient if we had just spent the money to sunset the old systems. And that was my biggest frustration working with members of Congress.
We were doing some cool things there with the ability to take voluminous medical records and be able to identify, just like you would in a Google search engine. Hey, these are the pages where the medical listing is talked about on these pages. And also over time, the machine was able to be able to assess a kind of a probability to those claims, provided they were fully developed, that this one looks likely to be an allowable claim when comparing it to the other things. So there's all sorts of advances that are happening, but the IT modernization is not a sexy thing to run home to your constituents and tell them that you got. Better that you get to go home and tell your voters, hey, I got more dollars to cure cancer. Hey, I got more dollars for childcare tax credits. But going home and saying I got, Social Security IT modernization funds, not exactly the sort of thing that turns the engine over for the constituency.
Commissioner O'Malley, my last question for you. We want to talk about the Social Security Administration serves somewhere between 50 and 60 million Americans, and it's going to be really important going into the future that type of service continues. There's been a lot of changes with the Department of Government Efficiency, with the current administration. What advice do you have in light of some of these changes that are currently being made at the agency?
Advice for people that are in pay status, or advice for people that work there, or Americans? And how broadly do you want my sage advice there, James?
Well, always want your sage advice. Let's cover all three areas.
Well, look, these last 90 days have probably been the worst 3 months the agency's ever experienced. And that's saying a lot when you consider it's a 90-year-old agency. They never missed a payment all through the pandemic. Could you have imagined the cascading terror on top of the regular terror of wondering if we're going to survive a pandemic? I mean, if 65 million people expecting a check, if that had been interrupted. Social Security is one of the greatest acts of caring and compassion ever put into law and effect by the people of any republic. And it is a pay-as-you-go program. In other words, the dollars that are paid in are the same dollars that get paid out that year, and Congress adjusts the 75-year forecast to account for and make provisions for certain anomalies, like all of us that were born in that baby boomer generation. So when you see the scary headlines that say Social Security going bankrupt by 2035, like a meteor is going to hit Metropolis, they're not really talking about the corpus of the program. They're talking about the built-up surplus that is being depleted sooner than they thought in 1982. But that's a solvable problem, just as the customer service is a solvable problem. But it's not a problem that can defy math or physics. It is a very sound program. There's every reason to believe that it is one of the most popular programs in America, too, by the way. 80% of us, Democrats, Republicans, Independents, believe Social Security should be strengthened and made better for the long haul, not be liquidated, turned into Bitcoin, or have a meat cleaver or chainsaw taken to its customer service staff. So there's every reason to believe that Social Security can be here for the next 90 years. But to govern is to choose. And what we see going on right now is such damage to this agency that I truly believe we're going to see a benefit interruption at some point for some period of time. I don't know how long that will be, and I don't have a meat thermometer to tell you exactly when. But all of the people that I've spoken to who used to work in systems at Social Security, who I've spoken to after they've left, have said that this Jenga tower will topple over because I don't know about your first car. Mine was a 1972 Pontiac Catalina. I would get frustrated sometimes when I had to put money into its maintenance. And my father would say, son, just because the car's old doesn't mean that it doesn't have to be maintained. So the old systems at Social Security do need to be maintained. I'm encouraging people to, as a part of kind of democratic hygiene, small d democratic, call your senator, call your congressman every week. Tell them you worked your whole life for Social Security, you earned the benefit, and you want them to protect it. And in the meantime, people should not be surprised and should be preparing insofar as they can, which is easy for me to say. I'm not one of those that relies 100% on Social Security to keep me from, living under a bridge. But people should be prepared for some benefit interruptions in the upcoming future as we struggle as a people with this moment in our history.
Secretary McDonald, let's go back to something you said. You said one job of a leader is to provide hope. My last question to you, there are more than 18 million veterans, and how we serve those veterans in the future for those who honorably served us will be important. Leave us with some hope and some inspiration. What is there to be hopeful for? What opportunities do we have ahead?
I'm the chairman of the board of the West Point Association of Graduates, so I spent a lot of time at West Point, and I was there a few weeks ago. And I can tell you, when I look at these young leaders that are coming through our military academies, we should have great hope and great confidence in our armed forces. Relative to the VA, at the time we first measured it, we brought in private sector principles, something called human-centered design to VA. The first time we measured veteran trust of the VA, it was 47%. That was the unofficial measure. 55% was the official measure. Over our 3 years, we got it up to nearly 70%. And then the secretaries that followed me got it up to, at the end of last calendar year, it was 90%. 90% trust of the VA. That is an incredible measure for a customer service organization of 400,000 people. Well, the challenge now is, how are you going to keep it above 90%? And I've got confidence that with human-centered design in place, with this measurement in place, with the Chief Veteran Experience Officer, Dr. Linda Davis, who was there in the first term, that they're going to recognize they got to keep that up. And if they're going to cut 80,000 people or 80,000 plus people, I hope they can do it and still keep that service number up, because to me, that's the ultimate test.
Leadership, communications, good use of technology, inspiring hope, and good maintenance of our institutions are key. Thank you to Secretary McDonald and Commissioner O'Malley. This has been a great conversation, and we'll leave it there.